first of all, we look at the clavicle. Okay. First of all, we look at the clavicle. The thing about the clavicle is the medial aspect of the clavicle, the part the sternum, with articulates with the sternum, is it's quadrangular. It's like a four-sided shape. But the lateral part is flat. So this is the medial side. This is the lateral side. On the lower side, let's see now the superior and the inferior. On the inferior side, you have a tubercle. You have a tubercle, and you have a groove on the lower side. This is the groove where the wait, what is the name of the bone? Okay, so you have a groove on the lower side, and you have a tubercle. So this is the inferior side, this is the lateral side, this is the medial side, right? So now we can see where this is. Okay, it will be like this. Okay, it will be like this. The bone should be like this. Oh yeah, the anterior side is convex. The anterior side is convex, while the anterior 2/3 is convex. The medial 2/3, the medial 2/3 in the anterior side is convex, while the lateral aspect, the lateral side of the anterior one third, and the lateral 1/3 of the anterior side is concave. So this is about clavicle. So now we look at the scapula. So when we see the scapula, what we identify is the spine. Okay, this is the spine of the scapula, and this is the acromion process. So the spine of the scapula is on the posterior side. The spine of the scapula is on the posterior side. Then we have to find the lateral and the lateral and the medial sides. So the lateral side contains the glenoid fossa. So this is where the humerus articulates. So when the humerus articulates with this, so it must be on the lateral side. It can't be on the medial side. So this is the lateral, the glenoid fossa, the glenoid cavity. Then you have the inferior, so the superior aspect is where the spines are, the acromion process, the coracoid process where pectoralis minor inserts into. Then this is where the clavicle articulates with the acromion, and so this is the superior aspect and this is the inferior aspect. So this bone, this scapula, is actually the scapula of the left hand, right? Because this is the glenoid fossa on the medial side, this posterior side, the spine is on the posterior side, and superior and inferior. So this should be on the left. This should be the scapula of the left hand.
Left hand.
Yeah. Okay. Okay, so we look in the humerus again. In the humerus, again, the head is on the medial side, right? It articulates with the glenoid cavity. Then we have one fossa on the posterior side. One fossa on the posterior side. If you feel your hand on the posterior side of your hand, you have one big fossa on the distal part of your humerus, and then there are two fossas on the anterior end of the humerus, right? And in the humerus, you will find the bicipital groove near the head. The bicipital groove on the lateral lip of the bicipital groove, pectoralis pectoralis major attaches on the minor aspect of the bicipital groove. The minor part of the bicipital groove, the teres major attaches, and the middle latissimus dorsi attaches like the mnemonic lady between the two majors, right? Then we have something here. This is a deltoid tuberosity. A little rays you can see here. This is a deltoid tuberosity where the deltoid muscle attaches onto the humerus. That's a deltoid tuberosity. So that's about the humerus. So this is left humerus. So now we look at the ulna. So when you look at the ulna, you will find there is this big large cavity here. So this is the anterior aspect of the ulna. So if you look at the ulna, that's you remember when you look at the humerus, there was a very large cavity, the olecranon fossa, right? So that's where the ulna actually attaches. So you'll find it's where it articulates. If you feel it in your hand, you'll feel the anterior aspect of the ulna. You'll feel the upper spine a little bit on the back side. So we know this is the anterior, and this is also in the front. So this we know this anterior and this is also superior. This is also on the top, right? Okay. Now we know the ulna is on the medial aspect of the hand. So then we need to look at the medial and the lateral sides. So if you look here, there is a cavity over here, and that is the cavity where the head of the radius articulates with. Okay, so then we know that this part, because the ulna is on the medial side, so we know that this cavity, this fossa, should be on the lateral side. So now this ulna is also from the right hand. So now we look at the radius. When you look at the radius, the first thing you'll notice is that the head of the radius is circular, and so this is the proximal end, right? Then you will have the radial tuberosity on the medial side. You have the radial tuberosity on the medial side, so you know that this side is medial. Now we have to know the anterior and posterior side. On the posterior side, you will find a groove. You will find a groove on the posterior aspect of the radius. And if you look at the radius, if you stand the radius up, then you will find the posterior end is slightly longer than the anterior end. Okay, so this is the posterior end, slightly longer than the anterior end. Then you have this posterior, and this is on the medial side. So this radius is actually on the this radius is actually on the right hand. It's on the right hand. So now we look at the femur. The head of the femur is very, very clear. It's very round. Yeah, it's the ball. And so this is the pressure epiphysis of the femur. And when you look at the femur, you will find that this is, so you know that this is superior and this is inferior, right? Proximal and distal. Then if you look at the femur, they are two trochanters. Okay, we have the greater trochanter and we have the lesser trochanter. The trochanters come in the posterior side of the femur. So we know that this is up and this is in the back, and the head of the femur should come on the medial side. So this is a left femur. This is back, right? This is back. The trochanter is on the back, and this is on the medial side, and it's on the superior side. So we know that this is the left femur.
Show that trochanters.
Okay, these are the trochanters. You have the greater trochanter on the up, and you have the lesser trochanter on the bottom, and the trochanters are actually traction epiphyses. Okay. So now we look at the tibia. When we see the tibia, first of all, you will find there are two condyles on the superior aspect of the tibia where it articulates with the femur. Okay. So, and you will also find the tibial tuberosity in the front on the anterior aspect of the tibia. So this is the tibial tuberosity. You will find the bump in the front. Actually, you can feel the bump in your own feet. So that's the tibial tuberosity. So we know this is the anterior aspect and this is the superior aspect. Now on the medial aspect of the tibia, you will find the medial malleolus. Okay, the medial malleolus. The medial malleolus actually forms the medial bump of your feet. This side, on the medial side, you will find this. This is the medial malleolus of your tibia. Okay, so this is the medial side and this is the superior side. This is in the front. So this tibia is of your right foot. So now the fibula is a little difficult to identify when compared to the rest. But then when you look at the tibia, you will see that on the lower end. So usually, sometimes the